Now, what people at Grady Hospital have indicated is that they are more than happy to help, like send people back to their country. Say, send you back to Nigeria, and that this, I'm wondering, is this a solution?
No, that is not a solution because that was the options they gave us. Actually, they gave us three options. One of the options was to relocate back to another state. Another option is you're going to go back to our country. And the other option, which is the third option, was to come to the emergency room when you become sick. And these three options are no options. A lot of people that move back home, for example, to Mexico, nearly everybody is dead as at now. Nearly all of them dead. And some of them wanting to come back, but Grady will not accept them. And they said some other states are doing outpatient dialysis, but it's not easy for somebody that is sick to relocate, and you are not even sure when you relocate to another state you're going to get a treatment over there. It's only when you get there that you're going to know. A lot of people move to Florida and they had to come back because in Florida you have to live in Florida for 6 months before you can get emergency Medicaid. So it's like we all have to come back here. And the other option is coming to the emergency room, which is not an option because you're not going to be scheduled on a 3 day, 3 week, 3 times a week dialysis. It's going to be when you are really sick, maybe like 10, 12 days, when your potassium is level is really high. And if your potassium is high and you're not dialyzed, you can have a stroke, you can have a heart attack, you can even die if you have a high potassium level in your blood. And that's what they're going to be looking for when you go to the emergency room. The potassium has to reach a certain level before they can give you emergency treatment, which is not an option. The only option is for us to get the 3 times a week, dialysis. That is the only thing that can keep us going.
And there are states where, as you say, as opposed to Georgia, where somebody in your situation would be able to get dialysis care, but uh, they have certain rules, like Florida, where you have to be there for a certain period of time. But in addition to that, you have a job, you're married, your husband's also on dialysis.
Yes, I do.
You have friends and family here, people you know, who
That's
sort of
correct.
can help you in difficult times when you're not doing well or your husband's not doing well. And all these people can't move with you to another state to be your support.
That's correct. The moving is easy for somebody that is not sick, somebody on end stage renal disease. It's very, very difficult to relocate. There's so much involved. My husband, his family, they are all here. He's born here in Georgia. We have all our friends there that comes out to help us when both of us, are sick or when we need help. But when they talk about moving out of states, that means we're going to be there by ourselves. And the problem is we don't even know what we're going to expect when we get over there. We don't know whether we're going to get a treatment.
Now, there are some people who could get a kidney transplant, right?
That's correct.
And then it would be less expensive.
That's another issue because if you don't have a green card or you're not a citizen, you can get a transplant. Even when you get a transplant, you have to have a good insurance because I believe Medicaid will only pay 1 year for your medication, and after 1 year, you're on your own, and you have to take the anti rejection for the rest of your life.
Are you on a list to get a
No,
transplant?
I'm not on a list because I'm not a citizen. You can be on a list if you don't have a citizen. You're not a citizen. You can be on the list.
But if you were able to be on a list, then you
Yeah,
could possibly get a transplant, and then it would cost a lot less, and you would also be more functional.
that's true. It's going to cost a lot less because all you have to do is just to take the medication and probably go for checkups, every once in a while. That would be a lot cheaper than the dialysis.
And then there's another way of doing dialysis, peritoneal.
That's correct. The peritoneal is a good one, but you still need to have your green card or be a citizen because you have to get your supply, a 1 month supply, shipped to your house. Even though you're going to do it by yourself because it's also known as home dialysis, you're going to be dialyzing yourself either during the night when you're sleeping or during the day if you're not working. But you still need to get your supply, and that's the area that costs money. So if you don't have insurance, you don't have a Medicaid, how do you get your supply? You still need your supply. You still need to go for your doctor's appointment to check up to see if your peritoneal there's no infection or anything. And another thing is I've tried so many options like getting an insurance, but nobody wants to insure me because I'm already sick with an end-stage renal disease because they know I'm going to be really, really expensive cost-wise. So I can't get no insurance.
Now, if you have your green card for 5 years, then you would be eligible in Georgia to get dialysis?
Well, that was the new law that came out in 2006 because in 2003 I was given a emergency Medicaid, which was stopped in 2006 because the law came out in 2006 that if you are not a citizen, you can have Medicaid.
So originally, Medicaid and the state of Georgia was actually paying for your dialysis.
Yes, they were paying for it. They paid for it up to 2006.
And then the state passed a law
Yes,
that
was a law.
said these people will not be able to get dialysis anymore.
That's correct. That's correct. You
And-
have to be a citizen or have a green card for 5 years before you can, be eligible for Medicaid.
And then a lot of those people went to Grady Hospital.
That was what happened. So I had to go back to Grady because the clinic where I was getting my treatment, after stopping the payments in 2006, they still dialyzed me for another 2 years. So I went back to Grady in 2008, towards the end of 2008.
So they were willing to do it on a charity basis for 2 years.
Yes.
But then after that 2 years,
They just said we
said-
have to go. So we have
what
no
company was that?
That was DCI, Dialysis Clinic.
They said, we can't take care
We
of you
can't do
anymore.
that no more, so I had to go back to Grady.
So they were providing charity care
They
for you.
were, yes.
And then Grady was the only
That was
choice
the
you
only
had.
place. That was the only option I had then. And a lot of people that were in my situation.
They went to Grady because
Yes, we all
Grady
went
was
back
the
to
only
Grady.
place.
Yes.
So the Georgia legislature, the governor, I guess, passed this law so that people could not get dialysis in other places. And then Grady was really the only place for them.
That's correct.
And then you were at Grady, but then Grady had made a decision to stop the dialysis. And they said they did that because they needed to save money. Now they say they're making a profit at Grady Hospital. Well, I should say the profit might come in certain instances because they have cut out services like the dialysis that were costing them money, so the patients like yourself are in this bind, but their bonus is given to people because they're making a profit at the hospital.
But I believe Grady is a non-profit hospital. And Grady is the only hospital in Georgia that takes care of people that have no insurance. So I don't understand what they mean by they are not making money. Because if it's a non-profit organization, they are not there to make money.